Well, welcome to another of our conversations with pathologists. My guest today is Dr. Melissa Upton, who is a dear friend from many years back, and currently is residing in Washington. And so, Melissa, let me just turn the floor to you and let you introduce yourself and tell a little bit about your background and how you got to where you are now.
Thank you so much. As Dr. Hessel's mentioned, we were both actually trainees together we rotated at the same hospital for a period of time many years ago. And that's when our friendship and trust for each other developed. And that was a real joy. Currently, I'm emeritus professor of pathology at the University of Washington in Seattle. But Dr. Hessel and I met when we were both training in Boston many years ago. And we've both worked many places around the country. So I worked in Boston for about 20 years. I actually went to medical school at Northwestern in Chicago and then did my residency there. And then I was in Japan for 2 years at the National Cancer Research Institute doing a research fellowship for 2 years, and then moved to Seattle in 2002. So different experiences in different kinds of settings.
Yeah, so your career, I think, is like many careers in pathology, is that you've had times when you were, very actively involved with clinical care. You've had times when you were very actively involved with research. You've had times when you were extremely involved with, resident or student education, and then more recently, even you've had a stint on the national scene, doing and leading a national organization. So amongst all of those domains, what do you see as the things that led you from one to the other, and what do you think were really the best choices that you made along the way in that regard?
That's a great question. Dr. Hessel is a very successful father, has raised a family. So I think you and I actually have some similarities. I raised 2 children who are now in their 30s, but I've been frustrated from time to time when national leaders will say yes, whenever you have an opportunity, say yes. And I think yes is important, but we also have to be very careful what we're saying yes to. And so I always tell people you can do almost everything you want in life, but not all at the same time.
Exactly.
So actually, in the very beginning, when my kids were little, I was very, very restrictive of how many evenings I committed away from my family. If I had to stay late on frozen sections or on call, I would do that. But I didn't go to all of the Pathology Society meetings in the Boston area, even though they were marvelous. I mean, they had superb speakers at all of those presentations, but I found that I needed time in the evening to be with my family, be with my kids, and it was important for my marriage not to constantly overburden my spouse with all of those evening responsibilities. So I think each person gets to make the best choices at different stages in career. When I did research very hard and very seriously. I also found that I wasn't honestly very good at focusing questions in research. In fact, I'm a generalist, and that's actually a great strength for things like being the president of ASCP, which I had the great chance to do, because that's very general. We cover all kinds of issues all over the map. It's not the best role for someone who has a highly focused interest in virology, let's say, or something like that, because do they really want to spend time reviewing challenges in training programs or issues around advocacy? So I think each individual really has to set his or her values to figure out what are the things you're doing at the stage of your life that you cherish, that are important to you, and the people in your life who are important to you. So similarly, I actually ramped down from 100% working commitment about 4 or 5 years before I officially retired, which was 2016. I'm still working, but a part-time equivalent. And I did that because initially my parents were ill and I had to help to take care of them. And then my husband, who is fortunately now a cancer survivor, he had cancer, and that was a long period of caring for him. And I felt too compressed that if I needed to go and spend time helping a parent with a degenerative disease, working full time and then having to fly down every other weekend to another location in the United States and fly back, I was just not able to manage that. So another thing I really believe in, I think I touched on this a little bit in my talks at the ASCP annual meeting, is people have to know themselves and how much rest they need personally. Some people I know who don't need sleep at all practically, or who can go very well day after day after day on 4 hours, 5 hours sleep. Most of us need more than that. So I think a lot of this is discernment and having the confidence that we know what we hopefully learn to know what we need to keep ourselves healthy and enthusiastic. So the changes, the selections of what I've done at different points in my life have really had to mesh with the fact that I wanted my marriage to thrive and survive. In fact, being married 39 years now, or 38 years, but having known my husband for 39. So that's a huge accomplishment. And you have, congratulations, I know you have a long marriage. That is a non-trivial achievement. And so I think that those things, we have to be able to take pride in those and not second citizen those important commitments to the people we love.
Yeah,
So I'm sort of meandering, but yeah.
No, yeah, I appreciate that. And that's an area we haven't talked about a lot in this series is the way that that pathology as a career meshes with other aspects of your life, your personal sense of balance and equanimity, your family needs, as well as, extended family needs. And I think you've touched on it very, very nicely here. And I will certainly second that, your recommendation about not doing everything simultaneously. Like you, I took a pretty stringent role in limiting my pathology related travel or other sorts of things when my kids were teenagers, and I wanted to be around to be a second parent, so to
Exactly.
say. And then when the kids are gone and you have more time, you can step out into the national or international scene a little bit more and do more of those kinds of things. So I think you've hit on it very nicely. And I think that's one of the wonderful things about pathology is that it oftentimes allows you that flexibility, and so forth. Maybe there were people in your departments or otherwise that maybe opened that door to you to some degree. Were there people that you worked with along the way that you felt like were particularly supportive of both your role as a mother as well as the other roles and hats that you were wearing?
Actually, yes, and I would really encourage, I mean, I touched on this a little bit in one of my ASCP talks, but I'll mention it again, that when I've gone and interviewed at jobs, I've had the overt process of talking about the job and what are the expectations. But I've looked really carefully at the overall complexion and culture of that workplace and whether there seem to be people who embrace and support the two career family. So one of the reasons so at a certain point, I was very, very happy in Boston. And then there came the point where my husband grew up on the West Coast and my parents had relocated to be west of the Rockies. So we had two sets of aging parents on this side of the country. So it was clear to us that we needed to relocate our entire center of the family life to be closer to aging parents, which was a really good decision because we were able to really spend time and be there very quickly a lot during the end of the lives of our parents. And when I was looking for jobs out on the West Coast, one of the things that I discovered at University of Washington was the chair at that time had a wife who worked full time. The interim chair, Charlie Alpers at that time was the interim AP director. His wife was a radiologist. When I walked down and talked to everyone in that department, almost every single person in that department had a working spouse. And that was very helpful because I knew everyone in that department was going to get it. And similarly, I had mentioned in one of my talks for the ASCP, when I interviewed at Beth Israel Deaconess, they got it. There was a pathologist there, Dr. Richard Cohen, who has passed away a long time ago, but he had been a full-time pathologist doing translational research and surgical pathology at MGH at a certain point in his career. And his wife died of breast cancer and left him with 3 kids, I believe, under 12. His youngest, I think, was still, I don't know if you knew Dr. Cohen, but his youngest child was really quite young when his wife died. And he recognized that he was going to have to recreate his career. So he actually stopped doing grant-funded research because he liked and was very good at surgical pathology. He moved to Beth Israel and he put his daughters at the school that was across the street from Beth Israel. So he organized his life around being basically a full-time solo parent working full-time. But he was a very strong advocate at Beth Israel Deaconess for the working spouses, all of us, men and women, for the process of life balance. And he was funny but very, very supportive. But many people in that department were supportive. My current department is supportive. So I actually strongly encourage young people not to be shy about looking at this culture when they're looking at a job. Because if you're the only person who's a working parent in that particular workplace, they're not going to really understand the need for flexibility. And I mean flexibility, like if your kid falls out of a tree at daycare and breaks their arm, you need to leave. You need somebody to be able to pick up frozen sections within 15 minutes. And I've been so blessed that all of my experiences, both at BI and BI Deaconess now at University of Washington, I'm in cultures where people will do that. They don't even hesitate. They'll just say, go home, I've got it. And that is just marvelous. So I would say that's something really to not be shy about looking for. I know you haven't been shy about that. You've put your family really as a very important center of your life. And I really salute you for that, because I think we need more leaders like yourself who unstintingly, courageously say, yes, it's okay. It's actually really important for you to thrive in your career, to find a place where you can be yourself. And that includes, I know you've done medical missions, having a spiritual life that's important to you, being able to celebrate religious holidays if you need those holidays off, whatever your own personal life requires for you to feel whole and to feel like a person who of value and purpose, then you need to look for that.
Yeah, and I think pathology is very well suited. It's not just the workplace, although that's clearly, there are different kinds of places. But I think in terms of the sort of mentality of the profession and so forth, that you find that much more frequently than say in surgery or perhaps even in radiology sometimes. I think there's much more collegiality. It's very much a team sport, and you realize you have to have a supportive team around you to be able to do that. So speaking of kind of the professional challenges and where you get your professional wins, your professional zings of thrill and so forth, and what about pathology attracted you to the field, and how did that attraction turn into things that you found really fulfilling, that sort of struck at your core values and your core talents?
Can I just have a minute? Because that was ringing a long time, Luke. Can you turn off for a second and those are great questions. So first of all, my dad was a pathologist. So I was very lucky that I grew up with a sense of pathology, but he was an experimental pathologist, not a surgical pathologist. And I fell in love with surgical pathology and autopsy pathology, anatomic pathology on my elective rotation as a medical student. But I know that one of the reasons I did that elective was because my dad was a pathologist, but also in that period of time, and you probably remember this because I'm guessing you had a similar medical school experience, we had a lot of pathology during medical school. We actually worked with a microscope. We sat and had boxes of slides. We did laboratory procedures. So that's something that's a sidebar to our conversation, but one of my concerns now is that many students don't find pathology because they don't actually have a chance in medical school to do some of the things that a pathologist does to determine if they like working in a microscope. I'm very visually oriented. My mom was an artist. My sister actually is an artist. So having I liked the multiple aptitudes in pathology. And one of the things I often talk to students about is to try to figure out what your own aptitudes are and the ways you like to ask questions of the world. So I wasn't very good at anesthesia because doing gas laws in my head was very non-visual. I mean, I could do it, but it was never going to satisfy that visual part of my, I did a lot of studio arts. I was a history major, but I was a minor in studio arts. I painted and did a lot of drawing. And pathology really has so many elements of my aptitudes. I like language. Pathology has language. I like the visual elements of anatomic pathology. I also love the science. I like to think scientifically. And all of those things are in pathology, plus the fact that, especially when you and I trained, you didn't have to really subspecialize because you got exposed to everything during the anatomic and clinical training track. And even within anatomic still now, if you do general frozen sections, if you are a cytopathologist, if you do autopsy pathology, you still bring into play a huge general range of knowledge. And in clinical medicine, although I really liked all the rotations in med school, I was going, do I only want to do neurology? Do I only want to take care of kids? And in pathology, we really have very, very broad options and applications. Even if you pick a subspecialty, you're still cross-cutting cancer and immunology and genetic disease and infectious disease. And that's, I think, extremely intellectually challenging and interesting. And then I did a brief surgical internship. I graduated early. I had gone straight through med school without taking a break. And I became an intern in surgery at Northwestern, where I went to med school. Because I really loved surgery as a student, there was a part of me that wanted to be sure that pathology was really what I wanted. And I quickly discovered that what I'd really loved about surgery as a student is that you'd do a history and physical, you'd feel a mass, and the next day you'd see that in the OR. And then I always ran down to the pathology department too to find out what it was. But in the internship, I discovered that how you took out that particular organ was much less interesting to me than what kind of cancer was it, or why did they get that cancer, or what about that particular patient made the disease course go that direction. So those are all, etiology and disease process questions. So it became much more clear to me pretty quickly that pathology would actually fit many more of my sort of way of thinking, way of interrogating the world, the aptitudes I had. And so I think that's a really important thing when we're guiding students, that often people think that what is easy for them is easy for everyone else. So if you're a visual learner, you just think everybody can notice and recognize one type of bird compared to another, or this particular type of cherry tree compared to another. And that's not true. And if you have that really good morphological set of skills, then there's certain types of disciplines in medicine where those are really well suited. Other types of aptitudes, working with instrumentation and figuring out how to improve testing, those are really well suited for some of the disciplines in laboratory medicine. But pathology really has a place for almost anyone with any aptitude, really, because we have such a range of things that we do. And even if people really want to see patients face to face, transfusion medicine and bone marrow biopsies, cytopathologists do FNAs, we can patient face if that's a real passion that students absolutely don't want to give up. They can come into pathology and still definitely be patient facing.
That's a good point. And I think you mentioned earlier the concept of soft skills being something that is really a need and very valuable in pathology. And a lot of people sort of pass over pathology because of that, patient contact component of medical care that seems to be missing by and large. But talk about how you've developed your soft skills, your leadership skills, your interactive skills through pathology, and what kind of fulfillment that development has brought in your career.
Well, some of my soft skills started to develop before I went to medical school. I was in student government in college. I was a history major in college. I read a lot of history. So I enjoy reading books about how people make decisions or things that have gone well or poorly in periods of history and how cultures react to that. In terms of pathology, I'm actually really extroverted, as you know, so I've always gravitated. If someone said we need somebody to represent the group here or there, I've gone and done that. I was chief resident at Northwestern, and I always encourage people, if you're offered that opportunity, I've known residents who turn it down, and I strongly encourage you to do it unless you have some really compelling reason that you don't want to do it, such as some people are trying to get their pilot research for a K award. That's a reasonable thing to put in place of doing chief resident. But I would say get the skills and get the opportunity to lead things, whether it could be an initiative in your department to help with an implementation of a new software system. But anytime you actually have to get into a group and work on a project with a group where you're actually articulating something that you're working on and listening to other members of the group who have different skills and aptitudes, those are all really essential, because that's really how we practice now. We don't do anything in isolation. And at University of Washington, every single cancer discipline has multidisciplinary tumor boards that pathologists attend. We also have kidney boards, there are neuropath boards, there's a weekly cardiac conference. So almost any area that any trainee is going to go into in anatomic pathology requires face-to-face contact with clinicians and other disciplines and the ability to work effectively. And particularly as we move toward value-based care, it's really essential for us to be able to show the value that we bring to a multidisciplinary team and help to argue for the tests that are actually helpful versus the tests that are not helpful in managing patients, and getting ideas with our clinicians of how to reduce unnecessary testing and costs in our institutions. Those things help the CEOs and the chief financial officers to also recognize the value that we're bringing to the institution overall.
Yeah, those are not individual patients, but you're certainly impacting care on a very dramatic and wide-ranging basis with that sort of situation. Well, Melissa, if your daughter or son were poised now in his second or third year of medical school and considering pathology, and looking forward based on what you can see and what you know about the field, what kind of counsel would you give to them about considering pathology and various components within pathology?
Well, I would definitely encourage them to come into pathology. I mean, I think it's the hidden jewel of medical specialties. And I don't know a pathologist who regrets becoming a pathologist. I really don't. I think that what I would also say, however, is it's not going to look the same way as it looks now in 5 years. We're really going to be moving more and more into value-based care and into the necessity to be members of multidisciplinary teams in our hospitals. Many people have said this in different ways, but if you're not at the table, you're on the menu. So if you're not actually going as a department or with representatives of the department into the places where decisions are made about resources, space, how the institution is going to expand, you have to demand and you have to be persistent so that when every other department knows that they're not just going to hire a new transplant surgeon to start a whole new line of transplantation without coming down to pathology, because obviously if they start doing small bowel transplant and you don't have a small bowel transplant pathology experience, you can't just ramp up tomorrow. You need to have the whole lab able to anticipate evolving clinical need, but we have to keep constantly in those places where those decisions are made so that people recognize that we're eager to help. We want to help. We want to help effectively. And we actually want to be members of the planning groups that bring those lines of care. We're not opposing those lines of care, but if we hide behind our microscopes and don't go to the multidisciplinary conferences or to the all staff medical meetings in our institutions, we lose the chance to show that we embrace the challenges, we care about the patients. The way we've ramped up nationwide so quickly to do COVID testing is evidence. It's a really important historic opportunity for us to really articulate to our patients and to the community of providers around us and to our broader communities that we get it. We really want to provide good care. We will lead it, and we will partner with whoever else wants to help lead these changes. But we want to be able to know the resources that we're going to allocate. And that requires working with other teams to, as I said before, maybe we don't offer this test if we're going to bring on this new set of initiatives that replace outdated or archaic approaches to that disease process, because we can't just add on more and more and more without particular resources, but we do need to be able to negotiate for those resources. So another thing, I've been really thinking a lot about burnout, because a lot of people have talked about burnout with me in wellness. And this may sound like a non sequitur, but I've been really trying to consider deeply what causes burnout. And I think the core facet of burnout, in my estimation, is that we don't have the resources to be successful. And so if we're always doing catch up, someone has brought on a new surgeon and we don't know how to interpret those biopsies, or we don't have enough text to process those things at night, or whatever, we're doomed. We are bound to feel unsuccessful. Feeling unsuccessful, for those of us who are laboratory professionals and pathologists, we are meticulous people. We are trained to get the right answer. We value appropriate turnaround time for our patients. And when we can't do those things, that is the biggest source of demoralization and burnout. You can run as fast as you possibly can, but if you don't have the resources to catch that train, you're never going to catch that train. So being in the driver's seat, or being at the table of the people who are planning the processes, is critically important for us to help with these decisions about how are we going to deploy our resources, how are we going to train people to keep up with evolving technologies. So to me, these are actually not separate things. Learning to be able to articulate, negotiate, be present, be participants is part of how we're going to stay well.
I agree completely, and I think the things that have enabled me to avoid burnout are those things: the pauses, the times when you catch your breath and you then can reassemble and reprioritize things, and then see, how do I go forward? Where's the scope and the direction that I want to go with things? Well, this has been a fascinating conversation. I wish we could go on and on, but I'd just like to maybe take one final question, Melissa, to sort of ask you. Can you think of a situation or a problem or a circumstance that for you kind of epitomizes all the good things that you've experienced in pathology, maybe with a student or maybe on a national committee, that just to use sort of saying as your moment to say, I was meant to be here for this moment,
Well, in terms of that, there are two questions there. I think I'm proudest perhaps of the pathology community response, the laboratory medicine, laboratory professional response to COVID. I mean, there's no question that when a need emerged, this community got together and did the work necessary, the heavy lifting to get that testing out there. We're not in charge of all the supply chain issues, but in terms of trying to give a full response to patients, it's been awesome. I wasn't involved with that because I'm not a clinical pathologist. But that is a very proud moment. In terms of my own life, what I'm probably proudest of is simply that when I was president of ASCP, I happened upon a reflection that Dr. Valerie Fitzhugh had written in The Pathologist about the challenges of being a Black pathologist, how difficult it was, and the kinds of clumsy and racist statements that she had encountered from others in the hospital, people mistaking her for a janitor, et cetera. My awareness just suddenly became searing that although I have always considered myself an anti-racist, this is an opportunity to do something at the national level. And so I actually called Blair Holiday. We develop our annualized budget of our initiatives in June, and it was later than that. And Blair just, I will never forget this. Blair said, we always have the resources to do what is right. And so we launched a diversity and inclusion initiative. And that was before the recent publicity around the videotaping of events with the police forces in different cities against Black citizens, which have been going on, unfortunately, a long time. They just haven't been videotaped to the extent to get into the consciousness of the wider population. But that initiative, just simply by saying we're going to do this, I was floored by the emails that I have received from people of color who are working in labs all over the world, who just said they were just simply said they were so grateful that someone cares and that someone actually is going to do something about this. And we're working hard on this. And the thing that also I find amazing is that every single board of director member of the ASCP raises the issues at every meeting, independently of me or anyone else being on the diversity and inclusion committee. They will just say, well, how are we going to be sure that our awards process is just? How are we going to we have blinded review of papers now in the American Journal of Clinical Pathology and annual meeting abstracts. And then, but also, how do you make sure then that you're inclusive in the faculty that you have representing you? It's a very interesting discussion because equality is not the same thing as equity.
Yeah.
And justice is part of the important prerogative here. And I know you have a very strong conviction. You've done a lot of volunteering in countries that are underserved in terms of their resources, that are poor countries. So I think the other thing that COVID tells us very clearly is there are no border walls that keep out disease and that keep out suffering. We're all one community. We're all brothers and sisters, no matter where we live. And so I'm most proud of that initiative, mainly because we started discussing things in a way that I think will hopefully continue to grow and develop and permeate the culture of pathology. But we need to understand in our culture where we have implicit biases, things that we do. One of the things I'm working on now, I'm the chair of our appointments and promotions committee. I'm very interested in partnering with people all around the country. How do we develop more holistic ways to assess our residents or prospective employees? Using only metrics of scores on tests, number of publications, is not going to work when you're not including experiences of people who maybe have to work full-time when they're going to school, or they go to a high school where their math skills are just not as strong. They're not going to get as strong a grade on something that involves mathematics as somebody who went to a magnet school and maybe repeats calculus in college. So we need to be holistic. We need to find people who think well, are creative, who are innovative, who are committed, and get away from lazy metrics when we evaluate people. But those are the things my passion now is how do I serve our profession in these soft skills and help other people feel confident and supported. Right now, I'm mostly trying to support the younger members, the younger people in our profession, so that they feel that they can thrive, they feel that they have opportunities, and they feel welcome.
Well, Melissa, you've certainly put a lie to the statement that you're not going to change the world by going into pathology, because I think you clearly are changing the world, both within your local domain as well as on the national and international scale. And it's just been a delight to hear your stories and to resonate with that. I think you're modeling the behaviors that will attract the right kind of people into pathology. And I appreciate you taking the time to talk with us today. It's been just a delight to do so.
Well, thank you so much. And I have to say, for people who don't know Dr. Liz Hassel, Liz has always been one of my heroes as well. A person who is just utterly trustworthy and ethical and lives a life that is a purpose-based life. And to me, that's the heart and soul of having a life that is both meaningful and satisfying is to have a values-based, purpose-based life. And I thank you. It's just a joy to reconnect with you. Looking